the parliamentary task force on COVID-19 is here in Kitgum, and we are here majorly to look at how the situation is, the things that are happening, and how the responses are working out, but the gaps and what we need to do to make sure we can fight this disease.
We tested quite a number of our community members, and the total tests as per that time were 258. Out of those, we encounter one death. In this current one, we had about 103 confirmed cases. Out of those, we encountered about 6 deaths. And right now, because of the new management plan which has been put in place, we had about 60 cases that have already been allowed home. But those ones who are currently under our management within their homes, they are 37. And that also brings me that we don't have isolation unit at the moment. What we have is the treatment center, which we happened to visit this morning. All the patients that were there, we have allowed them home. They have gotten cured and they are well.
Mr. Chairman, I don't know how the allocation of the vulnerable groups has been done. I don't know the criteria which was used to identify that Kitgum qualifies only for 3,675 persons. The population dynamics of Kitgum municipality is almost at the range of 100,000 people. And the vulnerable people who has been directly affected by COVID-19 is in excess of 10%. To the extent that I expected that at least our ceiling for the COVID relief fund would have been within the range of 10,000 people. So the 3,675 people, Mr. Chairman, it is just a drop in the ocean. We demand for more. Even the money is not forthcoming, Mr. Chairman. As I talk now, less than 1,000 people, according to the information I get, have received their money. The money is too slow, to the extent that some people are likely to get a heart attack in the process of waiting for this money. I challenge you, Mr. Chairman, to expedite the entire processes so that the monies come in handy and at short notice. I am made to understand that the municipality are supposed to have a task force of COVID-19. Generally, we have been under operations and guidance of the district task force. I am also made to understand we are scheduled to receive approximately 117 million for operationalizing the various activities of COVID-19 in the municipality, which happens to be the epicenter of the virus in the entire district and the entire East Acholi sub-region. We are being guided by the ministry on what to do this money, mostly on surveillance and fueling our vehicles and ABCD. The municipality that does not have a single vehicle to fuel. What shall we do using that money? We have no vehicle to fuel. To the extent that I'm requesting that if you can freeze that money in Kampala and you give us a surveillance vehicle for the municipality, because we don't need this money, it will do nothing. Or if you think the money will be useful, then we are seeking for your networking so that you get us a vehicle to help surveillance in the epicenter, in the municipality here, in Kotido, in Apache, in Nebi, and in the newer municipalities in the Greater North. I want to be sure with you, Mr. Chairman, If you give us the vehicle which we are competent to fuel, we don't need the 117 million. Because the guideline gives us more discretion to fuel the vehicle, which vehicle does not exist. We don't even have a tractor. Let me wind up. What is the position of Parliament? What is the position of government on COVID-19? Can it be one of the supplementary drugs which will be supplied by the national medical stores? Because we are made to understand it works. And some of us have started using it even before contracting COVID. So we want a clear position of government, we want a clear position of Parliament on COVID because we are made to understand it works and it works effectively.
Yes, we have had a meeting with the task force, but there are challenges and we have got a report, which report we will be able to present to Parliament. At the end of the day, there is a need of a lot of work to be done. So we are still heading to Namor, and we will be able to have a conclusive position which will be presented to Parliament in the next few days. Kitgum needs a lot of help. The hospital needs a lot of support. The task force needs to be supported, but also there are other concerns, including the number of beneficiaries for the COVID relief fund. I think that needs to be really looked into properly. In Kitgum, you cannot only support about 3,000 people. That is not proper. So we are going to look at these things and discuss at our level and make sure we can take a position.